Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to our new program on Medicine of the Prophet. Today's episode will be focusing on that healing comes from Allah subhanahu wa ta'ala. The program will consider how the body has its own self-healing mechanism. And it's ultimately controlled, of course, by Allah subhanahu wa ta'ala. And we will be discussing the issue around how to encourage you to work with this concept called Physis, or the body's self-healing mechanism, and not to work against it. Treatment ultimately comes from outside, and healing comes from within. All healing resides within the grace and the power of Allah subhanahu wa ta'ala. I want to draw in our guest, Dr. Mujib Hussain. Welcome, Dr. Mujib Hussain, and direct the question to you. Is there a hadith, Doctor, that guides us on the subject that healing comes from Allah subhanahu wa ta'ala?
Okay, Mr. Hussain, actually there is a very significant hadith, and it's related on the authority of Abu Rantha, which is the companion of the beloved Prophet Muhammad sallallahu alaihi wasallam. He narrates that he entered the tent of the Prophet sallallahu alaihi wasallam with his father, and his father happened to be a physician, attending to an illness that was suffered by the Prophet ﷺ. And his father mentioned to the Prophet ﷺ that you are suffering a back infection and I am a physician, please let me attend to you. And to which the Prophet ﷺ replied that you are my assistant, you are my patron, and Allah is my physician. So this is a very significant hadith when it comes to the relationship between the doctor and the patient, to remind us that it's of utmost importance to bring a spiritual reliance within the consultation room between the patient and the doctor for two reasons. The one, by having spiritual reliance, one can overcome the emotional or the negative emotional attributes that accompanies illness, like fear, worry, hopelessness, anxiety, by establishing the order of, or the truth of the matter that Allah controls the entire condition, Allah controls the healing. It brings some type of contentment to the heart of the patient, and at the same time, it re-establishes the responsibility that the practitioner has towards the patient, in that he has to seek the best treatment and he has to use the best judgment to provide best treatment, but ultimately Allah provides healing from within.
Wonderful, Dr. Mujib. It seems that even the doctor is conscious of the fact that Allah subhanahu wa ta'ala is within his presence as he dispenses with the advice on how to heal, and that the patient is also aware of Allah and Allah's grace and healing powers as well. So it's not just a pure reliance in and of itself on medicine. I should like to now draw Professor Rashid Bhika into the discussion here. Professor, is the concept of treatment coming from outside, healing coming from outside, I'm befuddled here, that treatment comes from outside and healing comes from within. Is that a universal concept, or is that unique to the traditions and practice of Tib?
Bismillahirrahmanirrahim. This concept of self-healing is not only in Tib, but it's a concept that is prevalent in most of the ancient traditions of medicine. For example, Chinese medicine talks about the qi energy. This qi energy is what is responsible for healing. Similarly, in Ayurveda, they talk about prana, right? And now, of course, again, similar concept, the body's self-healing ability, call it energy, call it whatever you want to. Of course, from a Muslim's perspective, it is Allah subhanahu wa ta'ala who is actually manifesting it. Now, of course, this concept of self-healing, or what you call Physis, comes originally from the Greek concept. And of course, we all know, that the Greek concept originated from Hippocrates, who we all know and accept as being the father of medicine. The term that he used was vis medicatrix natura, the ability of the organism to self-heal. Natura, nature. Now, nature does the healing, of course. And this concept was always prevalent and accepted by traditions. And of course, the role of the doctor or the role of the healer is to work with Physis. And in fact, there's a beautiful saying from Hakim Chishti, which goes something like this. He says, in fact, no herb, no food, or any other substance or procedure can do anything on its own to heal. It can only assist the body in its own self-healing. If your finger is cut, it is not the stitches or the bandage or the iodine that causes it to heal. It is the skin itself that performs this miracle. And of course, ultimately, this miracle is performed by Allah subhanahu wa ta'ala.
Wonderful. We will continue this discussion after the break with Dr. Mujib Hussain and Professor Rashid Bhika. And when we come back, we will discuss how the concept of Physis, or the body's self-healing mechanism, actually works. See you in a bit. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. We're looking in this episode on the issue that healing actually comes from Allah subhanahu wa ta'ala, and we're dealing with the concept Physis. I should now like to draw in our guest, Dr. Mujib Hussain, and ask the question, Dr. Mujib, how do you recognize the working of Physis?
Simply by looking at the body's natural reactions, the body's natural processes or response to environmental stresses. So when the body is under stress due to emotional stress, mental stress, what happens within the body? When it goes under physical stress, for instance, if you were to ingest something that the body doesn't agree with, like the typical food poisoning, why does the body naturally respond? Like for instance, there will be vomiting, there will be diarrhea, and we know in modern medicine these are seen or looked at as signs and symptoms of illness. But within TIB, we look at this as Physis working correctly. Like when your body spikes a fever, when there's a pathogen that enters the body or bacteria, the body breaks out in a fever. We don't see this as a sign or symptom of an illness. We see it as a Physis response. The body is acting the way it should respond. So the TIB practitioner recognizes the Physis response and facilitates this process, as opposed to actually halting the process. So the typical food poisoning, we wouldn't want to stop the diarrhea because the body wants to get rid of the bug. So we assist the body in getting rid of the bug. Instead, we'll regulate it. We wouldn't halt the process, because whenever Physis is halted, it manifests into harmful substances that can return later on in a more severe form.
Fascinating. Now, Professor Bhika, is Physis the same as the immune system?
In fact, this question is very often asked, because today the whole focus of promoting health or fighting disease is invariably placed on the shoulders of the immune system. Physis is much more than only the immune system. Physis is reactive. It is instinctive. Every action of the body, reaction of the body is controlled by Physis. I mean, if somebody walks in here with an AK-47, we're going to have a certain response. If somebody walks in here with a platter of roast beef, what's going to happen? You're going to salivate. So these are all inbuilt, characteristic, inborn, genetically programmed responses that the body does. So Physis is much more than only the immune system. Fair enough, the immune system is one of the components of Physis. Because yes, the immune system, I always use this example in our consumer workshop. The immune system is like the army of a government. It tackles outside foreign bodies or anybody wanting to invade the body and cause problems. But the government has got a lot more agencies that is doing its work. You've got the transportation, you've got the administration, you've got etc., etc., etc. So Physis controls every aspect of the body. When you are awake, when you are asleep. For example, when you are asleep, this is a time that Physis has got the opportunity to reorganize itself, all the activities of the day. So often when people fall asleep at night, what happens? You have sore and perspiration. I mean, Physis then gets ready, does all the circulation, make sure that for the morning the person is going to the bathroom to defecate. So these are all the natural bodily responses, instinctive, reactive, that Allah Ta'ala has given within the human being to stay healthy, to stay well.
Well, thank you very much, Professor Bhika. And just to recap and expand on the thoughts that both Dr. Mujib Hussain and Professor Bhika have raised, we have for you a short clip with Dr. Hakim Abdul Haq, who will talk on the issue of Physis and how it helps maintain good health.
Physis maintains good health by ensuring that homeostasis or balance exists in the body. In other words, Physis is not only to maintain a good health, but also it eradicates all the illnesses or the causes of the illnesses which are producing on a time in the body. In that way, we can say that the Physis is a self-healing ability, or in other words, this is built-in capability of healing the body in the human system. The roots of the Physis in our body, in that way that Physis work from inside to outside, upper to lower, front to back, and main organs to the less important organ in the body. The examples of Physis inside to outside, we get rash, we get boils, we get acne, we get measles, we get chickenpox. All these are the elimination of the toxins from the inside to outside, and in that way body protect the main organ from the inside from these toxins and send these toxins to outside like hands and skin and all that. In that way our main organ, heart, liver, brain, lungs will be saved. Secondly, that the Physis work from upper to lower, like if we get some pressure in the head because of high blood pressure, then our nosebleed, and is a nosebleed is a big healing crisis, and in that way that brain hemorrhage won't take place. Another way, like all the pimples on the back, first come on the back, boils come on the back first, not on the front, because front is a more sensitive area than the back. Then main organ to the extremities, like if there is a big problem in the body, so body save the brain, heart, liver and other organ. So as a result we get sometime paralysis or the hemiplegia of the extremities. Another big example of Physis is in certain condition the people get coma. Coma is a complete shutdown of the whole system. Physis say all the body that shut down, and Physis work on that illness. In that way the person remain in coma till the body heal the, or the Physis heal the inside of the damage or that area. I hope these examples will make you aware of the importance of the Physis, that how the Physis keep our body healthy and free from the illnesses.
Dr. Abdul Hakim Haq speaking to us around the issue of Physis and how it maintains good health. I now need to sum up, I suppose, before we take an ad break. And when we come back, we will expand a little bit more on this issue on how Physis actually helps the body to heal itself in a sense. See you in a bit. Welcome back. In this episode, we're looking at how health ultimately comes from Allah subhanahu wa ta'ala. That medicines in and of itself is but one way to deal with the health challenges that one might have. But in the end, it comes from the good grace of Allah subhanahu wa ta'ala that we enjoy good health. In the studio with me is Professor Bhika, as well as our guest, Dr. Mujib Hussain. Now, I should like to draw Dr. Mujib Hussain in and ask Dr. Mujib, as a critical practitioner of Tib medicine, how would you, sir, incorporate Physis in your treatment?
Okay, simply as Tib practitioners, we aim to assist Physis, not to stop or interrupt any processes. And we have to remember that as human beings, we are doing this on a daily basis, unknowingly. For instance, if you were to enter a cold environment, the hairs would stand on end, the body's trying to capture heat. So what you do, you put on your jacket. If you are experiencing too much heat, you begin to sweat, you remove your clothing. So in essence, on a daily basis, we are assisting Physis. So likewise, the Tib practitioner looks at the condition, it takes note on how the body responds to the certain condition and assists it. For instance, colds and flus. What happens? A pathogen or microorganism, bacteria enters the body recognizes it, it starts attacking it. Like the first place it will be like the sore throat, inflammation, redness. All the body's attempt to get rid of the bacteria. The body spikes a fever, there's heat introduced in the body. So the Tib practitioner sees this, recognizes this, and facilitates the process, as opposed to stopping the process. So the facilitation would involve using heating soups for colds and flus, abstaining from cold beverages, not having cold foods. And if we look back, we find that this is part of our upbringing. It's a simple phenomenon that takes place where we go outside during winter, put on the jacket. It's cold, make soup. So likewise, it's a simple, logical philosophy. But in Tib, we use it, and by following this understanding, we actually assist Physis, and by doing that, we improve the health of many of our patients.
So we recognize the role of Physis then in health maintenance and treatment.
Yes.
That was most insightful, Dr. Mujib. I would like to ask Professor Bhika, what advice then would you give consumers in working with Physis rather than against Physis?
So I think here the answer would be, in fact, my colleague Mujib has covered some of the angles that a consumer must look at. But I think that the advice I would like to also give, maybe just to add a bit to what Dr. Mujib has mentioned, that so often a person goes to the doctor with a cold and a flu. It's all very well taking the necessary medication, be it an antipyretic or be it an antibiotic. But together with that, you've got to stay away from certain foods, or keep yourself warm, etc., etc. This is sort of this is integral to the treatment. Of course, when it comes to advice on staying healthy, again, the sunnah, the healthy living lifestyle, if you are aware of Physis, you can live your normal day-to-day life, taking into account the role that Physis is playing. So yes, living with Physis, assisting Physis. Another simple example, now we're coming into winter, for example. It will be very silly to go out into the cold weather and not be dressed appropriately. I mean, I'm so fortunate, alhamdulillah, that I've got 13 grandchildren. And in all of these years, we had only one of them that ever ended up in hospital due to any condition. And that was, unfortunately, my eldest grandson, he had severe diarrhea and he became dehydrated. But purely because you monitor and you work, you're always concerned. I mean, one of the things that's quite funny is that the moment I walk into my children's home and my daughter or my son will say, "Nana is coming, put on your socks," because those are advices that was historically always there, but unfortunately it is neglected. So advice to the consumer: work with your body. Work with your doctor within, not against it.
Well, Professor Bhika, I think my good wife, Nazira, would endorse whatever you've said 100%. And I suppose just to reinforce what you've said, I should like to draw in Dr. Mujib Hussain and ask him to proffer some closing comments on this concept of Physis in health maintenance and treatment.
Ultimately, like we discussed early on, the relationship between the doctor and the patient relies on the spiritual reliance on Allah. So for all healthcare practitioners, the advice would be to bring in the spiritual aspect when it comes to treating your patients. By doing that, you can eliminate the emotional excesses like fear and hopelessness, and that way you increase the efficacy of your treatment. By doing that, you actually re-establish your role as a practitioner by giving the best advice, the best treatment, and Allah does the rest.
Wonderful. Professor Bhika, I suppose I should have to ask you to offer some closing thoughts or rejoinder on what Dr. Mujib Hussain has just said now.
I can just endorse what Mujib mentioned. Folks, work with Physis and not against it. Remember, you have a doctor within yourself.
Wonderful. Thank you very much. Well, I suppose it's time to tie up the loose ends. And in summary, we note that we understand that healing ultimately comes from Allah subhanahu wa ta'ala, as both Professor Bhika and Dr. Hussain have alluded to, and that the role of the physician indeed is to assist in this healing process. We have to recognize that each of us, we have a doctor within ourselves known as Physis, and that is responsible for the maintenance and the balance of our homeostasis in the body. And to stay healthy, we must assist the Physis by choosing the proper lifestyle, and similarly, when we are ill, as part of treatment, we must support our own inner healing, as Professor Bhika has alluded to. Now, although as Muslims, we accept that healing comes from within and also mainly and chiefly from Allah subhanahu wa ta'ala, we have it within our means to assist our own internal capacity to heal. This has been the medicine of the Prophet, your guide to healthy living. We'll see you next time, inshallah. Wa alaikum salam wa rahmatullahi wa barakatuh.